Welcome and thank you for watching Eye on New Mexico today. We are wrapping up October, which National Breast Cancer Awareness Month. We did many stories on breast cancer this month to raise awareness of this. One thing I learned by talking to many breast cancer patients is that we can't assume we're not going to get breast cancer. Women, we have to keep an eye on this. Early detection is key. And to talk a little bit about that today, my guest is Dr. Robert Rosenburg from Radiology Associates of Albuquerque. Thank you for being here, Dr. Rosenburg.
And thank you for inviting me.
Absolutely. What I said there, early detection, every woman, it sounds like, who you talk to who's had breast cancer, who's had a family member, they will tell you that's what saved their lives, was catching this early enough. Is that true?
Well, early detection is the key to the best survival. It's not a guarantee, but women with early breast cancer detection will do much, much better than women that find it later, especially if they find the lump. And the treatment options are better. They have more treatment option often when you have a smaller, earlier breast cancer.
I see. So that's why it is good to catch it. Now, at Radiology Associates of Albuquerque, of course, you do breast imaging. Almost everyone has heard of a mammogram. What is that? Tell us what a typical mammogram is, the traditional one, and then we'll get into something else unique you guys do.
So the traditional mammogram is an x-ray of the breast, and we take two pictures, one basically from the top down, and then the other from the side. It's really at a bit of an oblique. Two images, and it superimposes all of the breast tissue on this one image. And that's our traditional mammogram. We've been doing it that way for 30 years.
And we actually have a picture. Guys, switch the order that I put these in. Here we go here. The one on the left side is a traditional mammogram. And to the right, you see different slides from the 3D mammogram, which is what you guys can also do at Radiology Associates. What are we seeing that's different here?
So the new technology is a series of slices of the breast, a little bit like a CT scan, not exactly, so that you can remove what we call superimposition. So that white stuff you're seeing on the mammogram, most of that is normal breast tissue, but you can have breast cancers, which are also white, hiding inside or behind bits of normal tissue. And the 3D is an improvement in letting us see those abnormal areas much, much better.
We had a story on a woman who was going around the country even telling people, you know, pushing for 3D mammograms, saying that found her breast cancer, and unfortunately she was a little too far along at that point. But is this a breakthrough in terms of early detection and treatment? What are your thoughts on that?
So this is definitely an improvement, and it's an incremental improvement over standard mammography. It's still not going to solve all of the problems that we have with mammography. There are still patients that it's not going to find breast cancers, but it definitely sees things better and earlier than our standard mammogram, especially in that subset of women that have more dense breast tissue.
Yeah. We have some video that we shot out at Radiology Associates, so I'll go ahead and have them play that, because at some point here, here we got the exteriors here. You guys have a van, it looks like.
Yes.
Taken around, yeah.
Yeah, and so there are a lot of women that can't get to a fixed site, mostly people from outside the metropolitan area. And so we moved the van to make it easier for those women to get a mammogram. Oh,
that's excellent, especially being so many rural areas of New Mexico here. Now, inside, we're seeing this is the 3D imaging technology.
Yes.
Can you kind of explain what this is doing?
So the traditional mammogram takes a single picture, and that superimposes all that tissue. What the 3D system does is it does that same single picture, and then it supplements it with about 14 images from different angles. And from all those different pictures, it can then synthesize all of the different planes.
Yeah, and when a woman goes in to have this done, is it similar to for her, is it the same process as a traditional mammogram?
It's almost the same. Okay. The only difference is because it's shooting all those extra pictures, it takes longer. So it's about 6 seconds in addition to the standard, usually second or two mammograms. So they're going to be in compression longer, but it's very similar.
For so many women, this is just a routine part of a doctor's. But after you turn 40, which 40 is the baseline age now that they're recommending, is that right?
That's the
getting your
that's
first
the most
mammogram?
that's the most common age that we recommend for the standard patient.
So once you turn 40 and you start getting these a little more regularly, hopefully for most women this turns out to be just a regular part of a checkup and they don't find anything.
Right.
What happens when they do? What is the process then from getting a mammogram? What do you guys do next?
So the mammogram gets interpreted, and if we find something that we think might be a problem, and that happens in about 1 in 10 women, they get a phone call and come back to our facility. And we'll do usually additional mammograms and frequently also an ultrasound to better evaluate what we were wondering about. Most of the time, that's nothing. At our facility, and I think most places these days, when that is completed, the radiologist will talk to the patient and explain what we found, or more often, that we didn't find anything.
Excellent. And then, of course, at that point, for those who do find something, it becomes another battle, I guess. The real battle begins. And
then the next step, if we're worried about something, would be we call it a biopsy, usually a needle biopsy. We schedule those in the next day or two most of the time. And again, even most of those are going to be negative. But that's our approach to this early breast cancer detection, where we're going to take the risk of bringing people back, additionally doing a few extra biopsies, but trying not to miss an early breast cancer.
Excellent. Now, what about the idea of false positives that we hear about, where people, think they have something, and it doesn't turn out to be anything? Does it happen a lot?
Well, there's a lot of false positives. All those callbacks, that 1 in 10 are false positives. A lot of women come in with symptoms, and those, in a sense, are false positives. But most of the time, people have things they're worried about. There's nothing. But that's that balance between having a few more false positives, but trying to find something early.
And what is that usually? I guess that was kind of what I wanted to ask, was what is causing that read on the image?
It's hard to know. It varies with each patient. Again, with the dense breast tissue, most of the time you can get hormonal variations. The mammogram doesn't look quite the same as the last one, and so we'll have that question, is there something new going on? And we want to clarify it.
Interesting, yeah. We obviously always tell women to continue to do their self-breast exams, check themselves out. When you talk to the patients that come in, are you finding women that are doing that seem to know maybe that there is an issue, or do we really not know what could be happening within our bodies?
Breast self-exam is helpful.
Okay.
I recommend it. It's not perfect, but I always ask women if they've noticed something, because sometimes they do. And I want to make sure that we've answered all their questions, not just my questions on the image. But once in a while, the patients will notice something that we just don't appreciate with our standard imaging.
So something else they can follow up on as well. For the 3D imaging that you guys are doing now, you were telling me it's new, it's fairly recent on the scene here, but it is becoming more prevalent.
Yes.
More doctors are doing it. Is this something standard now that insurance will cover for women?
At this point, no. There are a few insurance companies that are starting to cover it, but for the most part, it's not covered. It's an additional copay by patients.
Okay, and for a woman who is in that position where maybe they've gotten that 2D mammogram, they want more, is the 3D option something you recommend then if you want to get a better look at something?
So we use the 3D option sometimes when we bring people back. So those callbacks for the false positives, sometimes we will use that to answer the question. But when patients ask me, it depends on the breast density. In other words, I think a lot of people who don't have much of this white, dense breast tissue, I'll say it's really not going to add much. But the ones that do, I think it's...
and that's good information, because I think people hear about these new things out there and they think, well, I want the best. But you were pointing out that really the information you want to get out there is that this is a tool that can be used and works really well for some women, but not every breast is the same.
There's a dramatic variability in mammograms. That's part of what makes our job difficult.
It is. It absolutely is. And we do appreciate you coming on to give us that information. Again, younger women right now, we hear some confusing statistics. You mentioned the baseline 40 years old for a first mammogram. Some will say as high as 50. others will tell you you're, in your 30s doing this. Does it depend on family history? How much of this do we need to factor in?
Family history is important for those segments where we have very strong family history of breast cancer.
Okay.
And when we hear that, we recommend patients get what we call a formal risk evaluation. And there are people that can look at the entire family history and give us a much better estimate of whether patients really are at much higher risk or not. Breast cancer is common enough that we'll see people will have a family history of breast cancer, and they won't know whether that really puts them in a high-risk category or not. So women are at the highest risk may get mammograms earlier, may also get additional imaging with magnetic resonance imaging, the MRI. But that's a smaller subset of the group.
Yeah, and as far as mammograms go, this is recommended for all women at some point with their age, because pretty much just getting older and being a woman is putting people at risk of getting breast cancer. Yeah,
the two major risk factors for breast cancer is being a female. We do see it in men occasionally, and it increases with age.
Yeah. So once you're 40, you have your baseline, you start to have these yearly at that point?
I recommend yearly. Clearly in your 40s is an advantage. I also think that if you know that it's done yearly, you'll get them every year. When you start spreading out the time, was it this year, last year, you start missing it. So I think there's little downside of getting them yearly, as long as you're willing to put up with the inconvenience.
Yeah, and I have not had one myself yet. I've not reached that age. Of course, I'm very interested in making sure I seek out early detection as well, and try to stay on top of this, as I've learned this month talking to other women how important this is. But I understand it's not the most comfortable procedure for women.
My wife warned me not to talk about that. But I'm told, yeah, it is uncomfortable, but it also varies a lot. The same issue that some people are much more tender than others. People just react a little bit differently. But it's a few seconds of compression, and then it's over.
Okay, so yeah, you got to put up with it for a shorter period of time, a few seconds, and then you do hopefully get some good information and hopefully some reassurance for most of these women who don't find anything. You're doing this on older women. Are you getting a sense that more people are interested in getting these done earlier now and getting them done more frequently? I guess what I'm asking is, have the pushes, the amount of awareness raised about breast cancer now, is that pushing more people into your office? Are we seeing that happening?
You know, it's interesting because there's a lot of coverage of mammography being good, mammography not being good, and different recommendations from different organizations. So it seems to be a little cyclic. I think currently, I mean, this is Breast Cancer Awareness Month, things are busier, but I hear from different colleagues that it does seem to vary, and I think we worry that some people are being pushed away from getting regular mammograms, and I think that's dangerous.
Interesting. Well, good to know, and certainly something, if you talk to your doctor or talk to the people at Radiology Associates of Albuquerque, and just thank you for giving us this good and not scary information, and just keeping it simple and real for us.
Well, you're very welcome.
That's what we women and men and families need to know. Dr. Rob Rosenburg, thanks for being here again, and stay with us. We are going to switch gears a little bit, but we'll have more information on a topic that affects your health, some of your health, coming up right after this break. Stay with us. Thank you for staying with us for Eye on New Mexico today. We're sticking with the health topic this morning, and joining me now, New Mexico's Secretary of Aging and Long-Term Services, Gino Rinaldi. Thanks for being here, Secretary, once again. Yes. And Carlos Moya, the Director of the Department's Consumer and Elder Rights Division. Thanks for being here, Carlos. Medicare open enrollment is underway now. It continues through December 7th, and this is an important time of year. It is really the one time of year where Medicare recipients can make changes to their plans, so you may have some questions about that. It's also a time when a lot of fraud is exposed, so we want to help some of you out there get some advice and resources this morning. So, Secretary, I'll start with you. Just Medicare open enrollment underway right now. If people are happy with their plans, they don't have to change anything, but this is the time to make changes, and what's your best advice for people?
Well, I think when when you're looking at what you've experienced over the last year with your plan, if you're happy with it, and if you really have a good rapport with your physician, with your insurance company, just stay put. I mean, if it's working, don't fix it. But if you have had issues and you've had some concerns and you're thinking, I might want to change, or these guys just didn't make it right for me. Maybe this is the opportunity for you to kind of take a look and see what's out there. Yeah. But if you're definitely dissatisfied, now's the time to make that change.
And start asking some questions. Yeah. You were telling me, I obviously, being my age, I don't know much about Medicare yet, but you were telling me there could be anywhere from 8 to 15 plans. And so someone could be looking at these and see a difference in what prescription drugs are covered by certain plans, the premium cost of certain plans. Maybe you could get a better deal. Yeah. So it's certainly worth looking at. Is this difficult for people to do? How can they go and compare plans?
Well, it is difficult because it involves you doing something about it, and sometimes it's like,
I know none of us like to deal with insurance, I myself included.
And then it does start to get a little bit convoluted. You start saying, well, there's this, there's that, and you start making that comparison. But one of the great things about this time of the year is that why we're here is because of what we can do. I mean, we do this options counseling through the Consumer and Elder Rights Division. We're independent, we're unbiased, we're neutral, whatever word you want to use. But we will give you a great opportunity to take a look at what's available, what works out for you, and we'll help you decide what it is that you're interested in.
Excellent.
And so that's a real advantage of working with us on this thing. So.
Yeah, Carlos, tell us a little bit about that. We have the Aging and Disability Resource Center. We have the state has some places that people can turn to get some advice and maybe be pointed in the right direction about Medicare and also other issues.
That's correct. Our Aging and Disability Resource Center is open Monday through Friday, 7:45 to 5 p.m. We can assist over the phone. If the clients want a one-on-one perspective with one of the coordinators, we do have events statewide. I would encourage them to look at our website and to find out where the nearest location. Many of these sites are on a walk-in basis or on an appointment. I would recommend that you make an appointment. Okay. Because the sites are filling up.
Wow.
So during the day, we will assist. Our calls have escalated, so we do have a voicemail, so people can leave a voicemail. We'll get them back. We're calling the same day, and we're getting people in a plan, doing a comparison before December 7th.
Wow. And that December 7th is a hard deadline. So if you don't make any changes before that, you will be re-enrolled in your previous plan.
That is correct.
Let's talk a little bit about the fraud that can happen to people this time of year. Unfortunately, I've already seen the warnings out there of scams, people getting phone calls saying, we need your information, we're helping you enroll in Medicare. Typically, it will never happen.
It won't happen.
That's correct. Medicare will never call anybody.
Yeah.
Okay, you're not authorized, and no vendors or providers are allowed to go door to door or solicit Medicare beneficiaries. That's the key. No one will ever call and ask you for Social Security and Medicare. So if you're getting these calls, the first thing we tell people is hang up. And to report this, we'd call the Aging and Disability Research Center, so we can take the information and we can pass it on to the local authorities or to the federal providers.
Excellent. So good advice, and I'll just repeat it again. If someone asks for your information over the phone, you have every right to just hang up. You can call these guys, you can call the state and report that right away, or at least check with them to see if it was a valid phone call before you make that mistake of handing over your information.
And I would say that, just since you brought up, on anything, nobody should be calling and asking you. I get those calls on my cell phone. This is the federal government, and you've just been awarded a grant, and what we need is your bank account.
I know, and they come up with something different to sort of entice you and make you listen. Is this a real thing or not? And I've certainly gotten those calls, and we got to remind people, just never give that information away,
never.
Especially your Social Security number, those things that could allow someone into some of your personal information there. Back to signing up for Medicare this year, there are some people affected by plans that have dropped out of New Mexico this year. So a good number of people, hundreds of people, have been affected by this and will have to change their plans.
Yeah, there's about 800 to 1,000 folks that have been enrolled with plans And I really would suggest that you should have received something from the, the insurer telling you that they're no longer going to be doing anything with New Mexico on this stuff. And I would suggest that you call the ADRC and at our number, and I'm sure we're going to be giving people that number here.
We will post that up. Yep.
To set up something so that they can begin to discuss what their options are. Because I think this is the most critical point that I like to make to folks is that it's neutral. I mean, when you go and talk to an insurance company about, well, you know, why are you the best? They're going to tell you why they're the best. And they're not going to point out why they're not the best.
Right.
And then you go to the next one, and then you get caught up in trying to make the comparison. We study this beforehand.
Yeah.
And we already know the pluses, the minuses, and then once you tell us what is your need, then we're able to try to
match you with that.
Yeah, make the recommendations. And it's called options counseling.
Options counseling.
Yes.
And we will have that number up. It's 1-800-432-2080 that you can call that number weekdays, again, from 7:45 a.m. to 5 p.m. I wish all of us had the ability to call up and have someone tell us, hey, which insurance should I go with? So that is great to take advantage of. What about asking your doctor directly if they're going to stay in your plan, or if they have any advice on what kind of plan you should be in?
If somebody has the Medicare Advantage plan, which covers your doctor, your lab, I would recommend that you ask them, are you going to stay on this plan going into 2015? If there is a possibility he's going to opt out, this is the opportunity to look for another Advantage plan.
And that is an issue for a lot of people who stay with the same doctors over time. And I mean, multiple doctors, not just one.
Yeah.
Do most of the doctors end up staying on? Has that been a problem that we've seen? Anyone having to change plans because of that?
Well, in New Mexico, we see physicians moving in, moving out.
Yeah.
And part of it is I would assume reimbursement, or where it is that they want to live or whatnot.
Sure.
So there is change. There's turnover in physicians on an annual basis. So it's important to know. As far as asking your physician, well, if I'm on X plan, that's who I'm getting reimbursed from, I'm going to tell you to stay on X plan. If you've had trouble with X plan, not your physician, but with
the plan, right?
You may want to talk with us and see if maybe there is something else for you.
Sure.
But ultimately, the choice is yours, and that's what we try to do: best prepare the consumer to make an individual choice with the information at hand.
Excellent.
Not try to just be pushed into one direction or pushed into another.
Excellent. Some great unbiased information, like you pointed out. Carlos, back to the Aging Disability Resource Center and your division of consumer protection with the New Mexico Department of Aging and Long-Term Services. You guys can help people with a lot more than just health care and Medicare coverage. We are consistently reporting on stories of elder abuse, nursing home issues, people just really having a lot of questions, and you guys are a resource for that.
Correct. Our Aging Disability Resource Center also serves as the Adult Protective Service intake line. So we get the calls. The long-term care ombudsman is also under our division, so there to assist within the nursing home. The number 1-800-432 is a really easy number to know as a one place so we can get you connected to Adult Protective Services. If there is somebody being abused, neglected, exploited, we can get you to the long-term care on state ombudsman if there's some issues within your nursing home. But we could also link you to supports and services within the community that people may not know about. The AAAs, the senior centers, the independent living resource centers to help people with those with disabilities, transportation within the community, congregate meals, home delivery meals. We have access to the database of about over 3,800 providers.
Wow.
So we can link you through the system. We can refer you and let the provider pick you up and do a follow-up call back to get you into the services.
Yeah, wow, that's impressive, and you're jogging my memory of all these agencies and services out there available for people, and constantly, again, we're getting phone calls from people concerned about their aging loved ones, Meals on Wheels, etc. You guys really have quite a network here under the branch of Aging and Long-Term Services, is that right?
Yes, we have probably 340 different senior programs, meal sites throughout the state.
Wow.
We're working with the Navajo Nation and all their various chapters, and then the Pueblos and the Apache tribes. I mean, so it's a very vast network, and it's been around for since 1965 when the Older Americans Act was passed. So it works very closely with the ADRC, And another big piece is for caregivers, you know,
Yes.
because oftentimes the ones that I get contacted from are friends and family,
Sure.
you know, there in Bernalillo, who call me and say, you know, my mom is having trouble here, what can you do? And they just know that I work up there. They don't
And
know.
I remember you telling me the last time you were here, so many people are caregivers in the
Yeah.
state. So many people are providing some type of care for another individual.
Yeah, or watching out
Yeah.
for their mom and dad.
Right, and we're just-
and that, so this is a, you know, if you have questions about what mom and dad are dealing
Yeah.
with Medicare, you know, just give a call.
Yeah.
You know, if you feel like you need to set up an appointment to get it explained and listen in on what's the deal and understand and help you to get on top of it, because trying to understand insurance. I remember my dad, he dealt with that with the public schools. That was part of his job. And then when he had to deal with it, he was like, you know, Dad, I know it's confusing. He's like, you know, this thing just, I dealt with this as a living and I can't figure it out. Do I pay it or don't I pay it? Is this what I'm supposed to do or
Yeah.
not supposed to do? And so the more information caregivers can arm themselves with, the better they are in helping their loved ones.
That's great. And you know, you were telling me there weren't a lot of changes this year necessarily. So this isn't necessarily going to be new information that you've never heard before,
Yeah.
but it's good to just review all your options. And your situation may have changed year to year, and you might be better served by another Medicare plan or option. So again, learn your options. Call that number, 1-800-432-2080, the Aging and Disability Resource Center, and talk about it. Make sure before December 7th you get the plan that
Yeah.
serves you best. All right, well, I want to thank both of you gentlemen for being here, Secretary Gino Rinaldi today and Carlos Moya for talking to us about this. And of course, anything you see, you can always contact us here at the station or check out our website for more details on signing up for Medicare open enrollment through December 7th. Thank you for watching, and we'll be back next weekend with another Eye on New Mexico.